The Chief Minister of Uttarakhand, Jairam Thakur, said today that the central government has accepted the detailed project report DPR for the bulk drug park that will be constructed in the Una district at Haroli. This project of national significance will usher in a second industrial revolution in the state, particularly in the pharmaceutical industry, he said, adding that the project steering committee of the union government approved the DPR today. Himachal Pradesh was able to secure prestigious projects, according to Thakur, because the BJP is in control of both the federal government and the state government, and both administrations are committed to fostering development and prosperity. He said, the state government is dedicated to completing the medical devices park and bulk medicine park projects in a timely way so that the region can gain their benefits. Quote. He stated that the bulk drug park would not only assure the retention of current pharmaceutical formulation units in the state, but it would also be a step toward India's independence. He stated that Himachal Pradesh Bulk Drug Infrastructure Limited would carry out the project. The Chief Minister stated that the overall estimated cost of the bulk drug park project was 1,923 crore rupees, with the central government contributing 118 crore, and the state government contributing 804 rupees, 54 crore. He stated that the drug park project would stimulate numerous socio-economic activity in the surrounding districts, including linked industries, housing, education, and commercial endeavors. The initiative would give possibilities for young entrepreneurs and raise living standards in the 5 neighboring districts of Una, Bilaspur, Kangra, Solan, and Hamirpur. Doctor charged in Maharashtra for erroneous sonography report that led to the death of a woman. A police official stated that on Saturday, a doctor was charged with culpable homicide not amounting to murder for allegedly issuing a false sonography report that led to the death of a pregnant woman in the Thane district of Maharashtra. The official from the Kogaon police station stated that an offence under Section 304A, culpable homicide not amounting to murder, has been recorded against a doctor who operates a sonography center in Kalyan town. During her treatment at a Kalyan hospital between March and April 2021, the 28-year-old lady was taken to a sonography center, where the accused doctor reportedly produced a report claiming that the baby's growth was abnormal, according to the accuser. According to the article, the woman died after receiving abortion drugs. The doctor's erroneous sonography report and incompetence led to the woman's death, according to the official. He stated that the local police were investigating the issue, but no arrests had been made as of yet. According to an international team of scientists, smart surveillance for viral spillover from animals to humans, targeted preparation, and drug and vaccine research, and global cooperation on surveillance and stopping disease spread are required to reduce deaths and lessen the economic impact of the next pandemic. In an article published this week in Proceedings of the National Academy of Sciences, 14 experts highlight pandemics ranging from 1918 to the COVID-19 outbreak as evidence that the world has largely failed to meet the task of being better prepared to prevent or respond to the next outbreak. Quote. According to an international team of scientists, smart surveillance for viral spillover from animals to humans, targeted preparation, and drug and vaccine research. Evidence suggests that the 2 SARS coronavirus outbreaks in 2003 and 2019 can be traced back to coronaviruses in bats that most likely spread to intermediate animal hosts in wildlife farms or markets before infecting humans in the instance of COVID-19 at the Hunan seafood market in Wuhan, China. The task group determined that the likelihood of a pandemic increases when humans and animals interact intimately in changing environments caused by land use and climate change, environmental degradation, wildlife commerce, population growth, and economic pressure. and global cooperation on surveillance and stopping disease spread are required to reduce deaths and lessen the economic impact of the next pandemic. In an article published this week in Proceedings of the National Academy of Sciences, 14 experts highlight pandemics ranging from 1918 to the COVID-19 outbreak as evidence that the world has largely failed to meet the task of being better prepared to prevent or respond to the next outbreak. Quote, "Future epidemics are unavoidable. The best way to reduce the likelihood of widespread disease outbreaks and pandemics and increase the likelihood of mounting a rapid response, according to the team, is to adopt a One Health approach to reduce these threats, working across disciplines and administrative barriers at all levels to understand and address the connections between animal and human health and the environment." Pranav Rajpurkar of Harvard Medical School, Matthew Lundgren of Stanford, and Adriel Saporta of New York University quantified the validity of 7 widely used saliency methods to determine how reliably and accurately they could identify pathologies associated with 10 conditions commonly diagnosed on X-ray, including lung lesions, pleural effusion, edema, and enlarged heart structures. To determine performance, the researchers compared the performance of the instruments to expert human judgment. In the final research, systems employing saliency-based heat maps consistently underperformed human radiologists in picture assessment and the capacity to detect problematic lesions. This is the first study to compare the performance of saliency maps with human experts in the evaluation of different X-ray diseases. In addition, the work provides a granular understanding of wheat ahar and how pathological traits in an image may affect the effectiveness of AI tools. Clinical procedures that use AI to interpret computer-aided detection methods, such as reading chest X-rays, currently utilize the saliency map feature as a quality assurance instrument. In light of the current findings, however, this function should be implemented with caution and a fair dose of skepticism, according to the researchers, due to the significant limitations discovered in the study. The researchers suggest that saliency-based heat maps need be modified before they are widely utilized in clinical AI models.